Hi, everybody, and welcome to Straight Talk Medicine. I'm Dr. Chris Morris with Arizona Family Health, and today I would just want to talk a little bit about women's hormones, especially those hormones that are responsible for perimenopause, menopausal type symptoms. So one of the biggest complaints I get here in the clinic is women coming in around, age 40 to 55, 60 sometimes, and they're complaining about just increased fatigue, weight gain around the midsection in particular, vaginal dryness, hot flashes, mood fluctuations, poor sleep, increased anxiety, agitation. And they're just like, what the heck is going on here? I never used to be this way. Well, what can I do about it? And I read on the internet about hormone replacement therapy. So there's all sorts of myths going around about hormone replacement therapy, and hopefully that I can clear some of that up. So hormone replacement therapy can help improve some of these symptoms. However, you got to keep in mind that these symptoms may be caused by other things, such as anxiety in particular. Anxiety can raise your cortisol level, and then that can also increase weight gain around the midsection. Poor sleep can also increase your anxiety. Thyroid disorders can cause metabolic dysfunctions and cause issues such as mood fluctuations, weight changes, fatigue, sleep disturbance. So, and before we start doing anything regarding hormone therapy, it's important that one, we have a visit, we talk about the pros, the cons, we review lab work, and we determine what is the best approach for you as an individual. The other thing to keep in mind is there's a lot of questions of, does hormone therapy increase my risk of getting blood clots, or does it increase my risk of getting cancers? And current evidence shows that if we use a topical hormone replacement approach, the hormones for the most part bypass the liver, and because of that, your risk of blood clots really is not much increased from baseline. So using the topical cream seems to be a much safer approach than doing like an oral estrogen, where it has to get processed through the liver, and then the metabolites of that hormone actually is what causes the increase in blood clots. Now, for cancer, we got to keep in mind that it's not for everybody. It really depends on your individual history, family history, so on and so forth. But as long as we're trying to go low and slow, we're starting hormone therapy, right around the time of menopause or perimenopause. For the most part, the benefits seem to outweigh the risk. And as long as we're not trying to go overboard on your hormones, we're trying to take a low and slow approach, it seems to be relatively safe as long as we're doing close monitoring, and we're there again, not trying to go overboard on shooting your hormones up like crazy. Now, if you want to start hormone therapy, if you're having any of these symptoms, please call Arizona Family Health. We're happy to help. We'll start off by just doing a frank discussion about your symptoms, going over your medical history, your family history, what medications are currently on. We'll get some blood work, and then we'll have a follow-up appointment, usually within about a week or two once all the blood work comes back, and we'll figure out what is the best approach for you. And then we're also going to have a frank discussion about, could this be hormone related or could it be something else? But at the end of the day, we want to make you feel better. We want to do the right thing for you as a patient. And ultimately, we want to improve your quality of life. This is Dr. Chris Morris, and we look forward to seeing you here in the clinic. Have a good rest of your day.